Welcome back to a new episode of Skin to It, your guide to healthy skin.
I'm Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, a trusted dermatologist.
Today, we're diving into an exciting topic.
We'll break down everything you need to know about skin cancer and share tips to help you care for your skin like a pro.
So grab your notepads and let's get skin to it.
All right, welcome back to Skin to It. On this episode, we're going to be talking about Skin Cancer 101. And I kind of like the concept of 101 as like a course, a deep dive into something. So when you come away, you actually go, okay, I think I understand what skin cancer is. We're going to talk about the common types, things, preventions, controversies about whether you need a screening exam every year. And we're not going to talk too much about sunscreens, as we did a really comprehensive episode on that in season 1, but we'll touch on it.
Well, listen, I thought this was such an important topic to cover. Obviously, it's more serious, but everyone's dealing with it. And I've definitely in my business, and I see I see clients all day long. I see people all day long, and I've noticed an increase in people who have had melanoma or basal cell. So I just think it's really, really important and essential for everyone to be informed about skin cancer. And I want to start it off by asking you, what is skin cancer?
But actually, I want to start off with a funny story about Marlo, because Marlo says patience because she does. When she sees her clients, she's known me so long that she actually is very well informed, and you're even more informed because of this podcast. And you were like, I think that you better go get that checked. So you do have some doctor tendencies in you with your clients, and you
I do love it.
patients. What is skin cancer? I think that's a great way to start, right? Like, first of all, what is cancer? So cancer, and let's even digress even further, is we are millions of cells, billions of cells. So each individual cell, whether it's in your brain, in your kidney, in your heart, and you can get heart cancer, that cell mutates and is overgrowing. So it's actually a normal occurring cell that mutates and is overgrowing. Cancer is just something that's growing. There's no checks and balances, right? So skin cancer is a cell in the skin, and we have multiple different types of cells in the skin that is becoming, it mutates, becomes cancer, carcinogenic, and the cells, multiply exponentially. So the basal cell is the base of the skin, the melanoma is the melanocyte, and the squamous cell is the squamous cell. There's other types of skin cancer, but they're rare, and we're not going to talk about them today. So let's actually start though with prevalence. Why did we pick this topic? You said you're seeing a lot. We're seeing it a lot because we're getting older. So as my patients get older, I see more and more skin cancer. As your clients get older, you're seeing more and more skin cancer. Skin cancer, unfortunately, in Canada and the US, is the only cancer that has increased. A lot of cancer's incidences have gone down. And that's according to the Canadian Cancer Statistics from 2023 and the American Cancer Society. In fact, the American Cancer Society reports about 1 in 5 Americans will develop skin cancer by the age of 70. So I just want to take a moment here, because I don't know, I'm sure a lot of listeners right now are saying, well, that means sunscreens don't work. Right? But they do. And we're going to get into why we have an increase, looking at the risk factors and something called lead time bias and all those kinds of things. So actually, that's a good segue.
Yeah. So, can you start to explain the factors that are driving these high rates and why North Americans might be at a particular risk?
Well, so if we look at what are the key factors, the number one is?
Well, the increase of sun exposure.
Sun exposure. So, I mean, we live in a society where people take more vacation, they wear less clothing, right? And so that is, if you look in the last, just think even about in 1930 or 40, people weren't wearing, no tops at the beach kind of thing, or jogging around the neighborhood with no top on, right? Like guys do. Which, by the way, guys, we don't want to see that in the spring and summertime. Keep your shirt on.
So not all of you.
So increased outdoor activities, increased vacations. And then the big one is tanning beds. Now, we've seen the pendulum swing because the World Health Organization has labeled tanning beds as cancer-causing. And I think people have the message that, they cause cancer. I've seen lots of women in their 30s who use tanning beds that have gotten a melanoma. So it is a cancer-causing thing. It should not be allowed, but it is still. Aging population, we already talked about this. And I want to talk about the concept of cumulative sun exposure. So every time you go in the sun, it's like a cash register, keeping a tally. And when you reach a certain threshold, that's when you develop skin cancer. And that's part of the reason why we have an increased incidence, is because people don't think about it. You don't see any damage to your skin. So why would I worry about skin cancer? So aging population, cumulative sun exposure, increase awareness. Everybody's aware of it. You just said, you see it, we talk about it. You might know somebody who's had it. So we call that in medicine lead time bias. So if we look for something, we're going to find it. And so we're actually, is it an increase in incidence, or is it just the fact that it was there, but we weren't looking for it? And then the last one is environmental change. Well, actually, there's a few more. Environmental changes, ozone decreasing, UV index increasing because of the ozone decreasing, and then just people tanning in general. And the research from the International Journal of Cancer showed that indoor tanning increases melanoma risk by 75% in people under the age of 35.
So that's the tanning beds.
That's tanning beds, but tanning in general, but tanning beds, yeah.
My idea of what skin cancer has really developed. I mean, obviously knowing you and speaking to you about it. And like you said, just as I've gotten older and seeing people who have it. And it's hard to think sometimes that something that can look very small can be...
Oh, yeah. Can kill you.
Can kill
or take
you.
a piece of your face off. Yeah.
Gosh.
Do you did you ever use tanning beds?
Never, ever.
Never. Yeah, I could say I never have. I've never
No.
smoked a single cigarette, and I've never used a tanning bed.
Yeah, no, I'd never
I have
smoked
other
either.
vices. Anyway, so tanning beds, yeah. So I think one of the questions was about base tan.
Right. So,
Yeah.
is there something about getting a bit of color on your skin, a bit of melanin does that actually protect you having a bit of a base?
I mean, generally the answer is yes, but I don't recommend that you do that with a tanning bed. I mean, for people who come to me and say, listen, I want to be the safest I can, what can I do to get a bit of color? Like when I go on vacation, I don't want color. I don't. But some people do. So I say, okay, listen, on the first few days of your vacation, use like SPF 50, be really protective. And then after you get a bit of a base, because you will, people think when you put a sunscreen on, you're not getting sun exposure. Of course you are. It's a screen. It's not a block. And then after the last few days, you might want to go down to a 30 or 15. I mean, I don't recommend that, but I'm listening to what my patient is asking me. If I don't give them the proper information, they're going to start with a 15 and potentially get burnt.
Right. So, Sandy, what are the different types of skin cancer? How do they develop? And what are the ones, like, what are we really, the dangerous ones? What are we really looking out for?
The most dangerous one is melanoma. Now, fortunately, the incidence is still relatively low compared to the other skin cancers. It's about 1% of the population. So it's still low, but it's deadly. It can kill you. Now, we have new treatments, and we'll touch on that when we get to that part. But the most common skin cancer, and it's actually one of the most common cancers, full stop, is a basal cell carcinoma. So remember we talked about a cancer is a cell that then is gone crazy. So at the base of the very top layer of our skin, which is the epidermis, because we have an epidermis, then we have dermis, right? Then we have fat and muscle. So the very bottom layer, base layer of the epidermis, that very top layer of the skin, the basal cells, which are somewhat stem-like, because that's why we constantly get skin every 30 days, right? That cell is mutated and it's producing too much skin or too many cells. And basal cells present like you said, these like little red things that don't look
flaky.
No, they're not usually flaky. They're usually pearly. They have blood vessels in them. They can bleed and they can scab. And they grow very slowly. So the good news about basal cells is they're not life-threatening. They won't kill you, but they can be disfiguring. So it is important to get them early. And then the last one is squamous cell carcinoma. So we go back to the epidermis. You have the base cell, and then you have the squames. That's all the layers above. So a squame cell mutates and produces too many cells, and it presents, it's kind of similar to a basal cell, like a bump that's bleeding, that's scabbing, that isn't healing. And those can grow rapidly. Depending on where they are, if they're on the lip or the ear, they could kill you. So they're a bit more aggressive. But the incidence of squamous cell is less than basal cell. There are other forms of skin cancer that are beyond the scope of this discussion for the general public.
Right.
Yeah.
And so Question for you. When you say, something that hasn't healed, uh, if you see something on your skin, like when do you start to say, oh, I should probably
Yeah,
see a dermatologist for
good
this?
question. I mean, and we're going to get to the sort of, problem with trying to see dermatologists in Canada and sort of run down that one a little bit. But if you're ever unsure, you try to see a family physician. Even that is hard now. So if you're really worried about something, go to a walk-in clinic. There are some of these apps.
But are we talking, sorry, are we talking 1 week, 2 weeks?
If you have something that is scabbing, not healing, and it does that repeatedly, right? I would say several months, because some people will come and say, I was dressing, I scratched this and it bled. And they rush to the dermatologist, or they rush to the family doctor. Well, see if it heals, right? You probably scratched it. It maybe got on your bra or your waistband. If it doesn't heal and it's taking weeks to heal, or it heals and then it breaks down again. So not days, not weeks, months.
Months. Okay.
Yeah.
So can you discuss how factors like family history, genetics, obviously UV exposure, and even skin type can influence one's risk? And are genetics important?
Yeah. So, I have patients all the time will come and say, my grandma had melanoma or something like that. So if it's skipping a generation, the genetics really aren't there. It's mostly in all the studies I reviewed. There was a great one in JAMA Dermatology. JAMA is the Journal of American Medical Association. That UV exposure, which is basically lifestyle, is the main risk factor for skin cancer. Genetics play a role, but it's less. And we're going to talk about that when we talk about the risk factors or like when we talk about whether you need a skin check and all that. We'll go through that. Actually, why don't we do that now? It's a good time. So what are the risk factors for the development of skin cancer? Family history. Okay, so we already touched on that, but not grandma. Okay. First generation. Because
So my mom, my dad, my aunt.
Yeah, because let's face it, our grandparents didn't have really much sunscreen. Okay. And if it was not very good. They covered up more, but still. So first generation, melanoma more than other skin cancers. So if you have a first degree relative with a melanoma, that's a significant risk. If you have a first generation with basal cells, but they grew up or they lived in Florida, right? So that's lifestyle again. So genetics, we covered that one. Number of moles. Controversy a little bit, depending on what study I read. Some people say 40, 50, 100.
And we're talking the whole body?
Whole body. So if you have a lot of moles, that is an independent risk factor for the development of melanoma. Okay, the number varies, but 50 to 100. There was also one study looking at the number of moles on your arm. If you had 10 or more, it showed statistically in the study they looked at that you might have a greater risk of getting melanoma. I don't want everybody to rush out that has 10 brown spots on their arm and say they heard that you have to go get a skin check. So you have to take it in because they may not be moles. They might be sunspots or skin tags or other things. Phototype. So that means, do you have blue eyes, fair hair, fair skin, freckles? That is an independent risk factor for the development of skin cancer. Tanning bed use, right? We already said you got tanning bed use. Blistering sunburn. One significant blistering sunburn increases your risk of melanoma by 50%.
When you think of all those people who sat down with oil on them and reflectors just to get these deep tart tans and ended up burning to a crisp.
Well, I have a funny story there because I was telling a patient once this statistic because their mom had, I think, died of melanoma. And they were so freaked out. They came back, they were on vacation. And sometimes you miss a little section, like right here, and she blistered and she thought she was going to get melanoma. And I said, okay, like a little area. Okay, you missed a little sunscreen. I'm talking like people that like are blistered all over the place and they're scabbing for weeks, like not one little miss of a sunscreen. So don't panic because we want to educate in this podcast. I don't want to incite panic.
Okay.
And then the last thing is immunosuppression. So a lot of people are on drugs that decrease their immune system. They may have lupus or rheumatoid arthritis or a cancer treatment that decreases the immune system. So it's controversial. We get a lot of referrals as dermatologists from other physicians who have patients on immunosuppressants. Like, can you see them once a year for a skin check? Like, it's tough. I mean, so I do take that into consideration, but I take all other risk factors into consideration.
And I guess another myth that we can talk about is sun protection only necessary at the beach or in the summer? I mean, obviously I wear sun protection every day of the year, cloudy, sunny, indoor, outdoor. I always have it on my exposed areas. But yeah, can you
talk to that
just
myth?
talk about daily protection?
So let's talk a few stories. I mean, I think everybody remembers the truck driver that went around with the one side of his face like just totally sagging and wrinkled, and the other side not.
Right. So the side on the outside, like where the sun was coming in right through the window.
Yeah. So UV rays. So let's actually talk about that a little bit. UVB rays are less associated with skin cancer than UVA rays. UVB rays cause a sunburn. UVA penetrates deeper and causes aging. It hurts your collagen and elastin and can cause free radical damage, which increases your risk of skin cancer. So UVA rays go through glass. So you want to wear sunscreen. And I had to write a letter actually because the Trucking Association is very complex, and to put a UV screen in your, that you have to get a letter from a doctor because it can maybe change the I don't know how well you see out of it. I don't know. It's some probably red tape thing. But I mean, they should all have, truck drivers and people that are driving for hours and hours should have UV screens in there. Yeah. Or wear sunscreen.
Yeah. Or wear sunscreen.
And then the other really important concept here is what we already touched on is cumulative sun exposure. So when you go out into the sun and you get a tan, that's an SPF of 3 to 5. That's your body trying to protect itself. So tan is not, the body's not looking at it like, oh, I look good. It's like, I'm protecting myself against damage. So the SPF of a suntan is showing you that you've actually damaged your skin with the tan. And what happens over cumulative years, like another common story, we touched on this earlier. People come and say, I'm getting all these brown spots, but I haven't been in the sun this summer. Well, you're 53. You have 53 years of sun accumulated. So you reach a threshold of pigmentation in the skin, because that's what the tan is. And then you reach that threshold, you start to get brown spots. Wow. Yeah. So to answer your question, you need to wear sunscreen every day, not just on at the beach, and also cloudy days, right?
Yes, absolutely.
Okay, I'm going to quiz you.
Yes.
What UV ray goes through clouds?
A.
Right. Good. Oh. And that is the one that will age you and give you skin cancer.
Yes.
So.
And as Sandy was saying, if you really want to get through to somebody who's younger who really loves to worship the sun, is instead of just scaring them and saying, oh, you're going to get skin cancer, just say you are going to age faster. Your skin will wrinkle faster, and nobody wants that.
Right.
You want to keep that youthful skin as long as possible.
Yeah, I have found with my patients, especially the younger ones, especially females, the argument of skin cancer doesn't work. The argument of wear your sunscreen, you'll age less, you'll age better, you'll age with less brown spots and wrinkles, and that works. Telling a young, healthy person that they might get skin cancer in 40 years, they're like, eh. Yeah.
Yeah, it's hard for them to imagine.
You're invincible at that age. Yeah.
Okay, so early detection, which you've discussed now, is obviously crucial for treating skin cancer successfully. That would make sense. Just like in any cancers, breast cancers, you want the sooner the better, the earlier the detection. So I want you to walk us through the ABCDEs of melanoma detection. So that is, as I've learned, asymmetry, border, color, diameter, and evolution. And why these signs are important, and really how to tell if a mole is bad.
Well, that's the $1 million question, right?
Right.
And so everybody wants to know, and everybody asks when they leave, and we have little cards and we go through the ABCs. So I've been doing this a long time, 28 years, and two things really changed how I explain this to patients. And I'll touch on the ABCDs, but I'll come back to that. And early detection is crucial with all cancers, and no more than melanoma is the most important, and basal cells and squamous cells less so, but still, it's still important. Okay, so a couple things. I have a very dear friend, Margaret Priest, who's an artist, and I remember once asking her years ago, Margaret, how do I know a piece of art is good? And she looked at me, and she's a professor emeritus of fine art, and she said, well, how do you know a mole is good? It takes years. So when I look at a painting, she said, I look for certain things. I look for the edges. I look for this. I look for composition, whatever. I don't know. I'm not an artist. And the point she was making is that you can give somebody the ABCDs and the rules, but a lot of it is just
Having seen it years after
Yeah,
years,
yeah.
and
And also, when you look, I mean, you collect art too. Like you look at a piece of art, sometimes you can't explain why it's so beautiful. But when you look at a bad one, you can go, "Oh, that's not so good." So we go back to what is cancer? Cancer is something that's growing uncontrollably. So when you look at nature, like this like beautiful flower we have here, or you look at a tree, or even us, we don't have one arm longer than the other. Our eye is trained to look at symmetry as beautiful. So when something isn't symmetric, we know that something's wrong. So when you're looking at a mole, you should be able to put a line through it and it should be a perfect mirror image of the other side. Not perfect, but almost perfect, right? So that covers off symmetry, which is asymmetry is A. So again, think about things in nature. They have symmetry. They've stopped growing, right? They're not. When something keeps growing, it's going to become asymmetric. So cut it in half. Should be the same on either side. Border, same thing. It should be nice and circular or oval shape. If you got all these jagged edges, you got cells that are going crazy, growing all over the place. So the border becomes irregular and jagged. Same with the color. You've got some dark colors, some light colors, some red colors, some multiple colors. That's not symmetric. And then the E diameter is, something that's bigger than a pencil head was kind of because some people's moles are bigger. So I don't really love that one. And E evolution, I also look at that as something that's evolving, but also E I think of as eccentric. So a lot of people have the same kind of moles. Some people have really dark, small ones. Some people have really big, pale ones. Some people have reddish ones if they're red haired. If you have a mole that doesn't look like the rest of yours, eccentric, something to think about. And at the end of the day, if you're not sure, see a physician. Now that's hard. I know it's hard. So there are apps, right? I just reviewed for my journal club all the apps and like they're not great. Sometimes what it can do is it can sort of triage you. Like it'll say, okay, this looks worrisome. Or so go maybe push a little harder trying to go to a walk-in clinic or something to try if you can. Or the app might say, this is a benign seborrheic keratosis. One of the biggest problems we have as derms is as you get older, you grow stuff. You grow tags, you grow these things called seborrheic keratosis, which are brown. They're large. They can be itchy. They're new. So they freak people out. And if we could somehow have a tool that could tell the difference between a seborrheic keratosis and a mole that's changing, I would I would invest in that. But we don't yet.
It's a human eye. It's the trained
Yeah.
dermatologist that is really
Yeah.
going to be able to tell you.
I think these apps can triage people, not diagnose,
But triage.
And
Okay.
they may be better used in, like if a family practice had a AI app that they could have their patient just do a sort of run by. And then if it has a ding, it's like, okay, this patient checked a spot. And then the doctor can look at it and bring them in sooner. It's the same with radiology. I think AI application in radiology is the best because radiologist has to look at 300 CTs or whatever it is, chest x-rays. The AI app's going to just ding the ones that are more problematic.
Okay, so I know this is a tough question and a controversial question.
Yes.
And one that you've spent a lot of time, considering.
Mm-hmm.
So do you need to get a skin check yearly by a dermatologist?
Right.
And I know there's only in Canada, let's say there's just over 700 dermatologists. So obviously, for every single person to be able to see somebody once a year is impossible.
Yeah. This is a very controversial topic within my specialty, within the dermatologists around the world. So the bottom line is there's no consensus. That's the bottom line. So I'm going to read this. The one that I found that was most compelling is there is a U.S. Preventative Service Task Force. Not government. It's not under the health FDA. But this is a group that looks at prevention and to assess the benefits and harms of whatever it is, like a routine chest x-ray for lung exam or getting a whole body CT scan so you don't get cancer. Like this is what people want, but could it be more harmful? Okay. Now with visual skin exams, they can't be harmful, but they can in a way because if our clinics are as dermatologists, there's so few of us in Canada. We're bunged up with like all these people that don't really need skin exams, and we can't see the people that actually really do.
That really need it.
Okay. So the conclusion in 2016 and 2023, when they looked at this question, concludes that the current evidence is insufficient to assess the balance of benefits and harms of visual skin examination by a clinician, this doesn't say necessarily dermatologist, to screen for skin cancer in adolescents and adults. So that's them. So then we look at the American Academy of Dermatology, the Canadian Dermatology Association. I looked at ones in Germany and the Netherlands. Essentially, I'll take the American Academy. It recommends that physicians assess the patient risk factors to devise individualized screening recommendations. So that goes back to the risk factors. Okay. If you have 0 risk factors, do not stress out your family doctor or your dermatologist to be seen every year for a skin check. It's not going to help you. It's not going to help the system. So what are the risk factors? Let's go through them again. And so when I see a patient, I go through these risk factors and I say, listen, you don't have them. I'm not seeing you yearly. Or you have them. I'll see you every year, every 2 years, every 3 years. Okay. So, and it's different for different countries, which is interesting. We're talking about people that are 35 to 75, first of all, not adolescents, because the risk factor is lower and it's not really recommended. Okay. So family history of melanoma. You have a you have a personal history of melanoma. You should have a skin check yearly by a dermatologist. That alone would keep us busy, the 700 of us in Canada. Okay? Family history of melanoma in a first-degree relative, not grandma and grandpa again. Okay? We get this all the time. People are so worried that my grandmother had melanoma. I'm going to get melanoma. Well, your parents didn't, your aunts didn't, your cousins didn't. It's lifestyle. It's sunscreen, lack of sunscreen use or sunscreen availability. Family history of non-melanoma skin cancer, basal cell, squamous cell, kind of more not as strong, but I take it into account with all the other risk factors. Because again, those are more lifestyle related, sun related. Skin color, light hair, blonde, we went through all that. That's an independent risk factor. Number of moles, independent risk factor. Presence of dysplastic or weird type moles, we call them atypical. That's another risk factor. History of blistering sunburns, indoor tanning use, immunosuppression drugs. So we look at all of these and we come up with an individual screening recommendation for the patient. That's all I want to get across. What we have trouble with is people that have no risk factors and want to see us every year. We can't do it. And it's not necessary and it's going to not be great.
So let's move on a little bit. Let's so when it comes to treatment now, because I think this is really important for people to know, options vary obviously by type and stage of skin cancer. Could you walk us through the primary treatments for a basal cell carcinoma, squamous cell carcinoma, and melanoma, and how effective these treatments are?
Right.
I'm guessing it's evolving, right?
I think for the general public, the most important, because there's like I could spend an hour talking about this. Surgery is the modality for the most part. Okay, we have with some basal cells. Sometimes we use some creams and things that can treat, but for the general public, it's a surgical removal. All right. So we need our plastic surgery friends. We need our dermatologists that are called Mohs surgeons to do the excisions. Basal cell, if you have the opportunity in wherever you live to have Mohs surgery. So Mohs is just named after Dr. Mohs, who described the procedure. Basal cells are tricky little buggers. Like they can grow like little pseudopods, right? So, and you can't see where they start and finish, and they can go deep. So you need to have with a Mohs procedure, the surgeon will take off the skin cancer, not close you up, go look under the microscope. They're also trained pathologists to see if there's anything left. So the percentage of recurrence after Mohs surgery is very low. And the thing about basal cells is they're not life-threatening, but they can be very disfiguring because they're common on the nose, they're common around the eyes, they're common around the ears. You could lose your eye if it grew too much. You could lose half your nose. Like these are extreme cases. So you don't want a recurrence. You want to be one and done. So if you can get Mohs surgery, it is, and even the plastic surgeon will say that, I can take it off for you, but I'd rather you see a Mohs surgeon. Squamous cell, excision, definite excision, because those can spread, those can metastasize. Actually, let's talk about that. Do you know what that means to metastasize?
Well, to spread.
Yeah. Do you know how that happens?
Yes, through the blood system, bloodstream. So like
see, I told you,
cells
like
will shed.
Yeah.
Like the cancer cells will shed
They
and
grow
get into the bloodstream and then flow through other parts and attach to other areas of the body.
Right. So the cells are growing like nonstop, and they'll hit a blood vessel to grow through the blood vessel, go into the bloodstream. So that takes off somewhere. Basal cells can't do that. So basal cells cannot kill you like in 99.9999% of the time. Okay. There's always an exception somewhere, but generally. Squamous cells can. They can, because they can grow more aggressively. They get into bloodstreams. They can go to your brain. They can go to your lung. They go to different places. And melanoma, that's the big problem. They grow down into the skin and get into a blood vessel. So excision of these things properly done by surgery is the best. And then again, this is sort of beyond the scope of this discussion, but if it has spread, we have one of the most amazing cancer hospitals in the world here, Princess Margaret Hospital. It actually was on the forefront of immunotherapy for melanoma. It is incredible. And we have so many great new treatments for melanoma that has spread or metastasized to other areas.
Amazing. So skin cancer prevention is obviously key. Public awareness remains still a challenge. Studies show that many people still don't use daily sun protection. So what more, besides listening to this incredibly informative podcast, what more can we do to increase awareness and encourage prevention?
So I researched this and looked at this a little bit too. And the Canadian Dermatology, we have a different group within it that just looks at sun protection. And so we try to get cities and governments to look at producing shade environments, like at parks, where moms and dads are sitting and kids are playing, shade devices, right? Clothing, UPF clothing. So it's like sort of sun protective clothing. The UPF is a standard of assessing the fiber and how much it protects against sun. So you can get a UPF shirt that's 50. So when you're golfing, when you're playing tennis, when you're doing all this stuff. So cover up, and a hat with a brim. What's the brim?
What is the brim?
No, what's the...
how wide should the brim
I'm quizzing
be?
you again.
I don't know.
3
inches?
3 inches, yeah. And then we had this thing called slip, slap, slop, which is just to try to get you to put on your sunscreen repetitively. Part of the reason for that is you miss places, you sweat it off, you don't get enough quantity on. So we talk a lot about that in the sunscreen episode, but reapplying. And then
and things you can take to from the inside to protect yourself.
Yeah. So anybody that is a snowbird, like we are here in Toronto and Canada, and a lot of people go south. I recommend, if they've had a basal cell, if they have a strong family history, or they're just not a big sun, like some people come and say, Dr. Skotnicki, I love you, but I just really hate sunscreen, so I'm going to come and see you all the time. Well, that's
not good.
That's not great. I mean, if they've had skin cancer, I kind of have to, but they can take niacinamide. So niacinamide, which is vitamin B3, you can take it twice a day, 500 milligrams twice a day. The studies have shown it can decrease the incidence of non-melanoma skin cancer, basal cell and squamous cell. Somehow it can decrease the DNA damage that what happens when ultraviolet rays go into the skin, they produce these little super radical things that damage DNA. DNA gets damaged, mutates, and produces cancer. So the niacinamide seems to decrease the damage. So yeah, if you're going to be south for months, or you live in Australia or somewhere warm, taking niacinamide twice a day, I think is a very good option.
So I guess just last piece of advice you want to give us: how can we protect ourselves against skin cancer? And any final thoughts? I
think if I hope that when people listen to this, the number one risk factor for the development of skin cancer is UV exposure. We said that 3 or 4 times, not genetics necessarily. There are some, but that's not the main thing. The studies show that sunscreens work. They help prevent. The reason there's an increase is we have lead time bias. Like people that were 18 and burning themselves, they're getting skin cancer now, right? And even sunscreen has improved since when I graduated. So avoid the sun. Pick something to do before 11, after 3. Wear your hat. Wear your UPF clothing. If you want a mineral sunscreen for day-to-day use for safety because you're worried about the chemicals, fine. Use a chemical sunscreen with a long UVA wavelength for the summer when you're out on the beach or whatever. And see your physician for a skin check if you have a lot of the risk factors we talked about.
Yeah, that was excellent, Sandy. Thank you so, so much. I think I really learned a lot.
Yeah, I think this was a great episode, and thank you for wanting to do it.
Yeah,
it was your idea. Yeah. Thank you very much for listening to Skin to It podcast, and we'll see you next time.
Please let us know what you thought of today's episode.
If you have any questions or thoughts, send me a message on social at Dr. Sandy Skotnicki. And don't forget, all the links and resources we mentioned are in the show notes.
And if you haven't already, please subscribe and leave us a review. It helps us to bring you the content you love.
Until next time, take care, and we'll see you next week on Skin to It.